It's time for the Bridge Business Break on WSAV, where we spotlight local businesses or events happening in your area.
Joining us today is Celeste McGrath from Southern Senior Solutions.
Hey, thanks for having me.
Yeah, thanks for coming in. So I know Medicare can be really confusing for people, especially those that are approaching 65 and up and their children as well. So Celeste, why don't you start with a little bit about you?
Well, so my tagline is guiding your Medicare journey, and that's exactly what I do. I help guide those who are on or already on Medicare walk through the ins and outs of Medicare, the rules and regulations, the plan options, the nuances that go along with it.
For those who may be new to Medicare, what is the biggest misconception that they're going to hear or that you may hear?
One of the biggest misconceptions that I hear often is people believe that Medicare covers everything. And while Medicare it's a very important healthcare program, it's government run, but there are other costs associated with it. So for example, there are co-pays, deductibles, services that are not covered. So there will always be costs associated with it. Medicare doesn't cover everything. That's why I always say it's very important to review your coverage and your options every year, because things change and you want to be informed of that.
What should someone do if they're turning 65 soon?
Best thing someone can do prior to turning 65 is start the conversation early. I generally tell people, when you turn 64, call me. But if you really want to be on the ball, call me at 63. There are things that can affect Medicare 2 years out. And for those who really want to be on top of it, it's really good to have that information prior to something happening. For example, the Part B premium is based on what your income was 2 years prior. So don't sell your house when you turn 63.
We know many people are already on Medicare, so what should we really be paying attention to throughout the year?
It's a good idea to keep track of any changes with your healthcare needs. So if you start taking a new prescription, keep a note of that. If you change a doctor or start with a new specialist, keep track of that, because you never know when the conversations are going to need to take place, and having an updated list of those things at all times is really helpful. It takes the stress out of a lot of it.
What advice would you give family members that are helping navigate Medicare with their aging parents?
I have conversations often with the adult children who have parents that are aging in or have gotten past the point of being able to do this themselves. So the best advice I have is start with simple conversations. Ask them about their medications. Ask them about their doctors and their, the healthcare needs that they have, because you never know when you're going to have those conversations with their doctors. It can happen quickly.
If viewers have questions when it comes to Medicare, where can they contact you?
The easiest way to contact me is just calling my office. It's 912-351-8137, or you can email me at celeste@southernseniorsolutions.com. My website is www.southernseniorsolutions.com.
Thank you so much for joining us today, Celeste, and telling our viewers more about Southern Senior Solutions.
Thank you so much for having me and for the opportunity to share Medicare education with your viewers.
Thank you for watching the Bridge Business Break. If you would like to see your business or event featured on WSAV, email results@wsav.com and let's make it happen.